Orthopedic surgeons often find distal clavicle osteolysis as a cause of shoulder pain in athletes who play certain sports, as well as weightlifters and bodybuilders. In this video, I explain what distal clavicle osteolysis is, how it develops, how it's treated, and why military service members often suffer the condition. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Distal clavicle osteolysis, honestly, it's a fairly uncommon shoulder injury, but it's an injury that often occurs in athletes and weightlifters, especially those that perform specific repetitive overhead movements. It results from repetitive excessive loads to the AC joint of the shoulder between the tip of your shoulder blade, the acromion, and the clavicle or the collarbone, small joint right there at the top of your shoulder. Usually it's through what's called horizontal adduction, internal rotation, and forward or lateral flexion of the shoulder. Such movements that could do that would be bench pressing or lifting heavy objects up overhead. This repetitive loading causes microtrauma to what's called the subchondral bone of the distal clavicle at the AC joint. Over time, you get these cystic changes in the end of the collarbone there. It disrupts the articular cartilage, and you can get what's called osteoclastic activity, basically these cells that eat away at the bone. What you see typically in patients with distal clavicular osteolysis, distal clavicle osteolysis. It's a history of weightlifting, a history of frequent repetitive overhead movements, or sometimes trauma to the AC joint, where especially you land on the outside of your shoulder. Typically what the person will complain about is a dull onset or a slow onset of dull, achy pain, usually on one side, occasionally bilaterally, much more one side than both. Typically, it's a pattern of pain. It gets worse with activities, and then you stop the activity, it gets better, and then it gets worse again as you start doing those activities again, especially weightlifting. Non-surgical treatments often are enough to get this better. Anti-inflammatory medications, ice, activity modifications, sometimes physical therapy can be really helpful, but if that doesn't work, yes, sometimes surgery is involved, and that surgery generally is either arthroscopic through a small open incision, taking out a small amount of the distal clavicle. Now, if you have ideas for topics for future videos for this channel, whether it's a certain injury or risk factor or anything else, leave those in the comments below. Make sure to subscribe to my channel, click the bell to be notified when I release a new video. And if you're interested in a Nexus letter for your injury or condition, click the link in the description below where you can learn more about working with me and working with my team. We try to make the process quick. We try to make the process simple. Try to do everything we can to make it easy for you. And I try to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you more.